going to go to my patient's room, and the first thing I'm going to do is wash my hands.
This was on the,
But it came with one on it too.
what made you send it?
I'm going to introduce myself
Sorry about it.
to the patient.
If you don't take it off.
My name is Savannah, and I'm going to be your nurse today. And then I'm going to identify my patient using 2 identifiers. And I'm going to check his armband for his name and his date of birth. And they do match up, so I've got the right patient. Next, I'm going to assess his lung sounds. And he's got his O2 monitor on, and right now his O2 sat is 98%.
Will this already be done for us? Yeah. Give me my food, baby.
Okay, after I've listened to his lung sounds, I'm going to explain the procedure to him, and I'm going to tell him that I'm going to be changing his tracheostomy dressing, and I'm going to be cleaning out his inner cannula. And then we're going to establish communication, and I'm going to tell him that if he feels increasing shortness of breath, or if he feels any uncomfort, I'm going to need him to raise his hand for me. And I'm going to ask for a return demonstration, and he can raise his arm. So this method of communication will be effective. And then I'm going to wash my hands again and get him set up.
This one has iron in it.
Yeah, she can work around it.
I'm going to check and make sure that my patient is in semi-Fowler position. I'm going to place a towel over him to protect him from fluids. And I've got my ambu bag here, and if his O2 sat drops below 92%, I'm going to need to hyperoxygenate him with 3 to 5 breaths. So now I'm ready to go ahead and get my sterile field set up. So I'm going to come over here, and I would have a new tracheostomy care kit, never been opened before. And I would be careful not to touch the 1-inch border, past the 1-inch border. And then I'm going to go ahead and put on my sterile gloves. Okay, now that I've got my sterile gloves on, I can touch the contents inside the trach care kit, and I'm going to get my sterile field, and I'm going to place the shiny side down. Okay. Then I'm going to get all my contents and put them on my sterile field. And then I'm going to get my sterile water. It's never been opened before. And I'm going to leave a little bit in here to rinse my inner cannula once I get done cleaning it. Okay, so now that I've got all that set up, I'm going to come over here and get ready to take the inner cannula out. And I'm still checking his oxygen side, and it's still 98%, and he's not in any distress. So I'm going to go ahead and remove his oxygen source. And I'm going to hold this down so it doesn't pull on his esophagus, and I'm going to unlock it and gently pull it out. Then I'm going to come over here and drop it into my sterile water. Then I'm going to come over here and remove my dressing around the stoma, and if it had any infectious drainage or blood on it, I would be sure to put it in a biohazard bag, but it doesn't. Okay, so now I'm going to take these off and put on some new gloves. Okay, I've got my new sterile gloves on, and I'm going to take my brush, and I'm going to get all the crust off of the inner cannula. So it's got the sterile water on it, and I'm going to take the brush and put it down in here to remove all the crust. Okay, and I've got my cap loose on my water, and it's got there's no more crust or any kind of stuff on it. So next I'm going to rinse it off and make sure all of that's gone. Then next I'm going to come over here and put his inner cannula back in. And I'm going to make sure I hold on down here to the patient and carefully place it back in and make sure that it is locked. Okay. Then I'm going to come over here and clean around the site. So I've got my 4x4s, and I'm going to get my sterile water, and I'm going to clean with one single swipe. Make sure this is nice and clean. Now I'm going to clean underneath there with my Q-tips. And get all the crust out from under there. Okay. So now I've got all my dried crust off, and I'm going to take an extra 4x4, and I'm going to dry everything off. And I'm going to be real gentle just to make sure all this is dry. Okay. And then we are going to place this new gauze under there, split gauze. Just gonna be real gentle, not to tug on it. Okay. Now, we're gonna go ahead and put the new holder on before we take the old one off.
Not yet. I'm gonna do my documentation and stuff. I do that today or tomorrow. We just got such a list of things. And then we can, I was thinking maybe Wednesday. All right.
Okay. Mr. Smith, I'm just gonna lift your head up just a little bit. And I'm gonna be careful because I want it to be tight enough to hold it, but I don't want it to be too tight. Just be very, very gentle, not to tug on it. Okay. Now I'm going to go ahead and take this old one off. Okay. And I'm going to make sure that it's tight enough to hold it on so that it won't get pulled out. But I'm going to make sure that I can place my fingers underneath there so it won't cut off his circulation. Okay, and then I'm going to place his oxygen source back on. And I see that his oxygen is doing good. It's 96%. Now I'm going to go ahead and listen to his lung sounds again. All right, his lung sounds are clear. He's not having any shortness of breath, and he's not in any distress. I'm going to make sure that he's got his call bell within reach, his wheels are locked, his side rails are up, and his bed is in the lowest position. And I'm going to make sure that he does not need anything else at this time. And then I'm going to clean up all my stuff. All right, I've got all my supplies cleaned up, and I'm gonna wash my hands again, and I'm gonna tell Mr. Smith that if he needs anything to call me, and then I'm going to go document.